case of the vibrator that you're talking about, let's talk about that. That's the Viberect, which for you're the inventor of the Viberect. It's something it's really it's getting a lot of profile now. Uh, in terms of using vibratory stimulation with a Viberect, what you're saying, if I understand you correctly, is you use the Viberect on a daily basis, but let's say once a week you use the Viberect together with a high-strength PD5. Do I get that correctly?
That is correct.
And
That is
ideally,
correct.
within a sexual environment, preferably with a partner.
Yes. The Viberect is specifically designed to stimulate both sides of the penis at the same time. A regular vibrator only stimulates one side of the penis, and in order for you to have adequate sexual reflexes to be activated, you need to stimulate both sides. You can't really get a good erection if you masturbate with a flat hand, or imagine having sex with only half of the vagina. You need to stimulate both sides of the penis. There are two different nerves, and I developed the Viberect based on studies that showed that using two vibrators on the penis increases sexual response by at least 50 to 60% in studies that were done independently in Miami project. Therefore, I recommend using Viberect because it's an easy device to use. It's approved. It's the only device in the world approved by medical regulatory agencies such as the United States FDA, CE, Australia, many other countries, Health Canada, to stimulate the penis for erection. It has shown safety. It has shown lack of irritation. You don't know what the vibrator that you buy for $10 from a pharmacy is going to, potentially injure the penis, because it's not designed for the penile tissues. So
So in
that's
this
why the
case, from what I
Viberect.
understand, in the United States, to offer a device like this, given how especially litigious Americans are, you had to jump through some major hoops, didn't you?
Absolutely. The Viberect is the most regulated vibrator in the planet. It has gone through multiple testings, electronic safety, EN 60601, multiple very, very strict testing to show that it does not hurt the penis, it does not cause skin damage, it does not cause nerve damage, it does not cause any type of damage. And it's been in the market for more than 2.5 years, and we have never had any complaints to any of the regulatory agencies. Why is Viberect specifically designed? Because it's a double head vibrator, and it uses a high frequency and amplitude that is not reproducible by regular, over-the-counter vibrators.
So what you were saying before as well is that it's not that the Viberect has actually been designed. You've got two models of it. It extends beyond just what we've been talking principally about in terms of penile rehabilitation following prostatectomy. You've mentioned that it's used for psychological issues like post-traumatic stress disorder and other factors, but you also mentioned the spinal cord injury. Can you just talk a little bit about some of the other applications of the Viberect?
I can only talk about applications that have been given to us by the FDA because of our limitation of claims. The Viberect, this is the exact wording. The Viberect is a handheld medical device for home use and clinic use to provoke penile erection in men who experience erectile dysfunction and to provoke ejaculation in men with spinal cord injury. Now, the cause of erectile dysfunction can be variable. It could be psychogenic or anxiety related, depression related. It could be men who have had the diabetes or other complications from medical disease. It could be men who have had surgery or radiation. So the causes of ED is not limited.
You mentioned some complications that can lead to erectile dysfunction. I want to ask you about a patient. We'll call him Max. Max is not his real name, obviously, for confidentiality reasons. But Max is a patient with a history of high blood pressure and heart disease. He's also undergone a radical prostatectomy. So, what advantages does vibratory stimulation have for patients like Max over alternate treatments like injection therapy and the use of PDE5s like Cialis or Viagra?
The first thing I would obviously I would evaluate how severe his erectile dysfunction is by having him fill, standardized questionnaires. I will ask him, how good is your erection with several treatments that he's using? I mean, is he using a highest dose of Viagra? Does he get a good erection? Does he respond at all? Is he injecting?
I suppose my question, really was more in the area of with some of these medical treatments, if they have high blood pressure or heart disease or diabetes, is it correct that in some of these cases they actually can't take PDE5s?
Oh, if there's a contraindication, yes, vibratory stimulation has no contraindication. The only contraindication for use of Viberect is whether you have a little soreness on the penis or some kind of an ulcer or some skin lesion, so you don't irritate it more. Men with cardiovascular disease or taking medications that are causing that would make use of Viagra, Cialis, and Levitra contraindication are not contraindications for Viberect.
So in other words, if they can't use PDE5s or injection treatments to aid with penile rehabilitation because of their heart disease or diabetes or any of these other conditions that prevent them from having the high strength PDE5s, for example, Viberect is a good choice for them.
It is a good choice, but Patrick, one thing that I always tell my patients is the following. Erection is a spectrum of disease. It can range from mild to moderate to severe. Men with mild to moderate disease that have potential still a chance for a spontaneous recovery and adequate sexual function should use vibratory stimulation religiously. Men who have profound medical disease, profound cardiovascular disease, men who have severe erectile dysfunction, they haven't had an erection in 10 years, or if they've had prostatectomy, that the nerves were completely removed and they were put on hormone therapy and basically radiation. We need to be honest with them and tell them, you have developed, basically everything has been done to injure your erectile function, whether it's your own medical disease or the treatments to treat your prostate cancer. In that case, I would recommend not wasting their time, and not with vibratory stimulation. They can still use it for orgasms and everything else, but I would tell them to seriously define how important sex is for them, and if it is important and injections are not working and they're not happy with the injections or there is contraindications, go for the penile implant. We don't want a guy to sit around and waste time at the age of 70 until 75 and basically not have any sexual activity for 5 years and then decide to have a penile implant when he's already too sick to use it. I would say get one as soon as you realize that things are not working and move on to the next step.
I understand that the U.S. government, namely the Department of Veteran Affairs, has recently put its support behind Viberect. Can you tell me a little bit about that?
Yes, the Viberect is now approved and is covered for all U.S. veterans and active military personnel for treatment of erectile dysfunction, and also the Viberect X3 version is approved for treatment of ejaculatory dysfunction. Remember, Patrick, there are hundreds of thousands of U.S. veterans who are young, and they're coming out of Iraq and Afghanistan and service to our country, and they have developed erectile dysfunction, either psychogenic or depression related, anxiety related, and these patients usually do not successfully respond to Viagra, Cialis, and Levitra, and they are very frustrated. So the studies that have been done have been reviewed by the Veterans Administration and also their own experience with the Viberect, as well as the use of the Viberect in infertility clinics for men who have developed a spinal cord injury as a result of their service. The Viberect is now approved for as a option for men with erectile dysfunction.
So they're using them for IVF and things like that. Is that what you're saying?
They're also using it for IVF, for obtaining sperm for in vitro fertilization. Yes.
Right. Dr. Tash Karimi, I really appreciate you taking the time and the candor and the extensive detail that you've been able to educate us with this evening. Very, very valuable information, and I think what you've done is you've helped educate the listeners to this program, but you've also helped really, you've been very honest in your approach, and I think we're very, very grateful for that.
Thank you, Patrick, and I'd like to thank you and what you do, and I have great respect for sexual therapists who spend thousands of hours encouraging post-prostatectomy patients to be optimistic and coach them in their long path to recovery. Many patients have benefited from your work, and people like you. One thing that I like to stress is sexual therapists should be a very important part of your, your armament for penile rehab. Studies after studies have shown that a surgeon who coaches their post-prostatectomy patient along their recovery, their results are better. And that's why I sit down with my patients, and just like you, Patrick, and I tell them, listen, be optimistic, don't give up, your urinary control is going to come back, and everything we're going to do is going to improve your sexual function. Be optimistic, don't give up, don't get depressed, because if you get depressed, everything is going to fall apart. Remember, Patrick, anxiety, impatience, and depression, these are the three enemies of erection. And if you get into a cycle of depression and anxiety after surgery, your nerves will not wake up, because you will basically be in a constant state of sympathetic adrenaline rush that kills erections. What I tell my patients is relax, don't focus on erection. When you're making love to your wife, don't think about erection, because the minute you think about erection, you will not get an erection. You need to focus on the pleasure of sex, on the touch, on the experience of sexual encounter, and erections come themselves. Don't focus on erection. Many men, thousands of men, have a performance anxiety, even post-prostatectomy. This is a concept that I'm sure you're well aware, that many men after prostatectomy have such low self-esteem that they are so frustrated during a sexual encounter that they basically kill any possibility of getting an erection.
Just through performance anxiety.
Performance anxiety is a killer of many successful nerve-sparing surgeries, because their wives is like saying, come on, sweetheart, you can do it. Come on, sweetheart, you can do it. And that's not going to help. I encourage the wife to stop setting a timeline for their erection to come back. Just pleasure each other, and erection will come back.
Once again, I just want to thank you for joining us today. It's been a terrific conversation we've had, and I feel deeply honored and privileged that you gave us all of this time. Thank you very much.
You're welcome. Thank you so much.